I'm the community engagement coordinator for the Princeton Public Library, and I'm delighted that you're all joining us this evening to learn more about this critically important issue in Princeton, in Mercer County, and across the nation. When Megan Cubano from HomeFront, New Jersey, reached out to see if the library would be interested in co-presenting a program that HomeFront was organizing, we leapt at the chance. I think most of you know Connie Mercer, director of Homefront. She is one of those people who it feels like should have an adjective in front of her name, like the indomitable Connie Mercer or something. I think the first thing that I came to know about her is that for over 30 years, she has been a hardworking, formidable advocate for people who need help. As I prepared for this evening's presentation, I came across a feature about her in the Town Topics a little while ago, and I read that she'd returned to. No need to.
You didn't warn me.
I read that she'd returned to New Jersey and started a recruitment agency. And that at some point at that time, a friend of hers who's a pediatrician brought her to the motels on Route 1 and said, "These are hungry, homeless people in your town. Fix it." I feel like Connie is one of the only people I know that would hear that and think, okay. The article goes on to say it was due to Miss Mercer's unceasing efforts and leadership, along with the help of dedicated friends, colleagues, and concerned citizens, that Homefront came into being. And with that, I turn the mic over to Connie, who can tell you a little bit more about the work that she's done with Homefront and introduce you to some of the friends and aligned organizations that help to continue this work tirelessly to support everyone in our community that needs food, shelter, and support.
See, when you get to be old enough, people use adjectives like that in front of you. So, Emily, you've got a ways to go yet before. Um, Kim, thank you for that really kind introduction. And I will tell you that it is true that about 30 years ago now, we started Homefront, working at local motels that were filled, hundreds of families, homeless families who had no place else to go. The motels were god awful then, they're god awful now. How do I know that? Well, let me tell you about what happened in between. In between, Homefront worked very hard, our volunteers worked very hard, the community worked very hard to say that there would not be hungry homeless kids in our community stranded in God-forsaken motels. And a little over 20 years ago now, Homefront no longer brought meals out to people living in motels because there were not children in motels anymore. There weren't very many people, in fact. There wasn't the need. And that was a glorious thing. We were the only community in the state of New Jersey that could brag that we did not warehouse children in homeless kids in god-awful places, that we had a real plan for helping them get through homelessness and move on to self-sufficiency. I was very proud of that. A year ago now, just about a year ago, Homefront started bringing meals again to people living in those same motel rooms. They look just the same. They're just as scary. They're just as without hope as they were 30 years ago. Why we started doing that? Well, because in our community, COVID has taken a real toll, and there are once again hungry homeless kids who have no other place to be. And that's why we thought it was so really important to have this forum and to bring some of the experts in the county together to talk to folks about what they're seeing in terms of what's happening in our community and across the country. I'm going to ask you to introduce yourselves and to tell everybody who's out there why you guys are here today. What your what it is that you're going to be able to talk about, and to let folks know about why they should listen to your voice. Uh, Sarah, did you want to start?
Sure. Good evening, everybody. My name is Sarah Stewart, and I apologize because my cat really wants to be on this Zoom with us tonight. I'm trying my best. But I'm the Chief Operating Officer at HomeFront, so I have the honor of working with Connie and helping the families that HomeFront was established almost 30 years ago to help. Connie gave you a little insight on what HomeFront has been doing during the pandemic, and in some ways it's the same mission we've had for 30 years, helping families break the cycle of poverty and ending homelessness in our community. So some of the work is the same and some of the work is very new and different. And so I'm looking forward to sharing a little bit about what we have been doing both as an agency, but also what we've seen in the communities from families that are living in deep poverty, the ways that the pandemic has affected them, and then what we as an agency and what we as a community have done, can do, should do to impact the lives of those families, especially families with young children. That's been HomeFront's focus and at the heart of our work since its founding, and remains very present for us every day.
Bernie, why don't you go next?
Thanks, Connie. Hi, everybody. I'm Bernie Flynn. I'm the CEO of Mercer Street Friends. I've only been in the job just over a year. So when I started at Mercer Street, it was in February, and then lo and behold, in March, the pandemic hit. We're an organization that is the food bank for Mercer County, and we also work with families, social services that are provided to families and young parents, as well as we're involved in education, primarily in the city of Trenton. Prior to me joining Mercer Street Friends, I was an employee at NJM Insurance Group. I spent 25 years there. My final 10 were as CEO at NJM. So I have been part of the Trenton community even before my years at NJM, because I was at the Attorney General's office. So Trenton is near and dear to my heart. Connie's been part of my journey, particularly in the nonprofit space, which we'll talk more about, as we proceed. But it's a real pleasure to be on this panel and to be talking about the important issues of homelessness and hunger that touch all of our organizations.
Okay. Bernie, at some point tonight, I hope you'll talk about the difference between being part of a corporate organization and being in the trenches in a nonprofit, because you have had some fascinating insights. Greg?
Good evening, everyone. My name is Greg Stankiewicz. I'm the statewide coordinator of the New Jersey Community Schools Coalition. But I'm here tonight, and I'm happy to be here tonight because I am so moved to be part of this panel. Connie's vision and drive has been just an inspiration to me. And Sarah and the team there in HomeFront do such wonderful things. My organization is a coalition of people here in New Jersey who believe in the community schools model and strategy. And it's a way of thinking about public schools as hubs of their community, bringing in services from nonprofit businesses, for government agencies, all together to where our kids are, which are the public schools. And I'm very proud to be here tonight with Bernie, because Bernie's organization, Mercer Street Friends, is the lead agency for a couple of the very strong community schools in Trenton. And so I've been very, very moved by the great work that they've done every time I go to visit. And so they're an example of what can be done using a community schools strategy. But it really is an emphasis on partnerships. And that's what I'd like to be talking about here tonight. And I see it very much similarly to the great work being done by these other organizations here. The Community Schools Coalition focuses on students that have out-of-school barriers that they have to overcome. They're not going to do well in school until they can overcome those barriers. And so those barriers are different from community to community, but a community school strategy is a way of bringing these resources together from our own communities to be able to uplift these students and help them succeed.
Okay. Emily, you're looking at this from a national perspective. Tell folks what you do.
Yeah, for sure. Hi, my name is Emily Lemmerman. I'm a research specialist at Princeton University's Eviction Lab, which is in Mercer County. And so I'm super glad to be here, just recognizing that while we study things that are on the national level, this is a real issue that's affecting families in Mercer County. And I'm so grateful to be here alongside all of you folks who are doing really wonderful work every day just to make sure that families can get by day to day, as hopefully there are some larger changes made in the long term. So the Eviction Lab is a lab at Princeton founded by Professor Matt Desmond, who wrote this book called Evicted, which discusses the kind of scale of the eviction crisis in America. And so people are often surprised to know that prior to COVID-19, there are more evictions every year than foreclosures at the height of the Great Recession. And so, and also right before COVID-19, there were more evictions than there had been even during the recession. And so the lab was seeing 3.7 million eviction filings annually, or 7 eviction filings every minute in 2016. That's in a far stronger economy than the one that we're having right now as a result of this pandemic. And so, yeah, really happy to be on here to talk about eviction, particularly during this pandemic, and happy to be here with all of you.
Wow. The one bright note in what you said is that you're at Princeton University. It's so wonderful to have Princeton engaged in such an important subject and engaged in a really hands-on, helping to make policy kind of way. Okay, now the question I get asked all the time is, you know, by my friends, by the folks who live in our community. Come on, Connie, is there really hunger in our community? We don't see it. Bernie, Sarah?
Well, Sarah, do you want to go?
Go for it.
All right. Well, for me, having started at Mercer Street Friends, the food bank for the entire Mercer County region in February, and then having the pandemic hit in March and having the schools shut down and having the rest of the economy shut down. I frankly, I didn't know which way was up. I didn't anticipate being so intimately involved with food bank related operations when I got started, because Mercer Street is a multifaceted organization. And as Greg mentioned, I'm very interested in the educational aspects and the social service aspects. And all of a sudden, it was all about making sure there was food in the community.
Bernie, just going to stop you just for a minute. I think there might be some folks who don't know the difference between a food bank and a food pantry.
Yes. So the food bank, we're like the wholesaler. We're the warehouse. And it's primarily shelf-stable food that we store. If we get fresh food, we can store that in our freezers and coolers, but we don't have as much capacity as we would like. We're improving on that right now as we speak. More capacity for freezing and store and cooling. But we're the warehouse, so we have pallets of shelf-stable food, and we distribute that to more than 100 food pantries, food sites, soup kitchens, HomeFront being one of them, multiple, food sites that HomeFront is responsible for. And it is the retailers in the food network like HomeFront, like Arm & Arm, like the local, YMCAs, the Trenton Area Soup Kitchen, the Rescue Mission, and several others, church-based organizations. They're the ones distributing the food directly to those in need. So it's quite a network, and we have support from organizations like the Trenton Health Team in terms of organizing that network and keeping us together, and in a collaborative fashion, ensuring that we are strong with regard to the information in the community as to where the food is needed. So going back to the question of, are people really hungry? Well, unfortunately, people have always been hungry in the city of Trenton and in some of the nearby, towns. So that's a constant state. It's a matter of degree. But with the onset of this pandemic, when everything shut down, keep in mind that, much of the economy is low skilled, low wage work, particularly in Trenton. Some of it, very cash oriented. There's a significant undocumented community. Most of those jobs just disappeared overnight. Well, people had to have food, and there was a tremendous response by the community. So, I would say this: people are hungry in our community. It has gotten worse. We do not have prospects in the near term of it getting better. The response is something that, in my estimation, even though I'm the new kid on the block, has been very impressive. We've been supported by, government funding and tremendous philanthropic funding. And one of the challenges is making sure we get food to the right places, and the people who need it. We need to go to them. We can't sit back and just raise our hands and say, we have food, come get it. We have to go to those in the community, because I will tell you, the city of Trenton, very much a walking community. That's one of the challenges right now with the weather so bad.
Yeah.
So again, in short, and I'll let Sarah pick it up from here, there's hunger, and there's more of it now since March, and we're going to be dealing with this for quite some time.
Yeah, I totally echo what Bernie says. From our experience in the communities, we've seen something very similar, right? So pre-COVID, there was a lot of hunger in our community, right? It's more visible now, right? The news is out at lines at food banks, and they certainly are longer, and I'll talk about that. But for this evening, I pulled up some of the statistics on hunger in our community. And many of you are familiar with the free reduced price lunch program in our public schools, right? Greg probably knows a heck of a lot more about it than I do. And so that's a program where families that meet certain income thresholds are eligible for support in accessing free and very low cost meals for their children. And so to Bernie's point, they're obviously talking about in Mercer County, as of I could only find from a couple of years ago, about 10,000 children in the Trenton Public Schools that were eligible for free and reduced price lunches. 10,000 children, right? That's almost 90% of the population of children in the Trenton Public Schools. So that's an incredible number, right? That 10,000 children who live within 5 miles of where I live are hungry right now or food insecure right now, is an overwhelming number. But I'm also here to tell you, to Bernie's point, this is not just an urban problem, right? So if you look at those 10,000 children that live in the city of Trenton, there are more children in Mercer County in all the suburban communities. There's another over 10,500 children from all of the other communities, right? So it's almost 40% of children in the Hamilton Public Schools, 45% of the children in the Ewing Public Schools, about 15% of the children in the Princeton Public Schools, 25% of the children in the Lawrence Public Schools, right? And so this isn't just an urban challenge. That is where it's most visible and most present. And there's different challenges, and to Bernie's point, different drivers of that. But the reality is we're talking about hungry kids, right? And that tonight in Mercer County, there could be 20,000 children that might not have enough food on their plates. Now, free and reduced lunch, we could talk a lot about that and whether that's the right indicator or not. But that gives you some sense of not only the depth, but the breadth of this challenge pre-COVID, right? And then COVID hits. I can speak for our food pantries where, March, April, May of last year, a year ago now, we were seeing lines that were double, triple, more than that at our food pantry locations. And this is when everything was shut down, right? So there was people weren't taking public transit, people were walking miles. Just like everyone else, there were supply chain issues. So not only was there people were losing their jobs and facing that economic instability, but they're also, just like anybody who had funding was having trouble finding things, families in need were as well. It has our numbers have remained high, right? They're not still quite at that triple level, but certainly above any levels that we were at a year ago, 2 years ago, 10 years ago. The demographics have also changed a bit. To Bernie's point, there were a lot of folks that are not being reached by the programs that you're hearing about, right? So the state of New Jersey has made the right call and they've increased food stamps. And so families that have access to public assistance programs are receiving more support through those programs. But if you're talking about families that are undocumented, families that were working in cash situations, right? They're not getting unemployment boosts. They're not getting some of this targeted relief that's coming to families. And so we've seen a lot more families coming out of the shadows, frankly, and coming to us for assistance that we'd never seen before. In the earliest days, it was 2 to 1 families that had never visited either HomeFront or any food pantry before. So 2/3 of the people coming to our door were people who had never visited a food pantry before, right? So it is families that had either never known that hunger or had never been in that desperate of a situation. So I'm making 2 points. First is that hunger was very present in our community before this, right? And so this is not just a COVID problem. COVID unmasked and exacerbated the economic inequalities that pervade our society, and as such, revealed a whole new world of families that were having trouble putting enough food on the table.
One of the things that Sarah didn't mention when we had to so quickly gear up at HomeFront for the onslaught of new people coming in, we also had to have all our forms translated.
Yeah.
We had not before
Creole and Polish and you name it. We are working in languages we have never worked in before.
Greg, you.
Please, I just wanted to jump in very, very quickly just to say that, just to reemphasize what Sarah and Bernie said and highlight what Emily said as well, is that if you look at the academic data, there's something called the suburbanization of poverty. And so areas that never were facing issues of poverty before are now facing it all across the US, but especially here in New Jersey. I'm a former school board member here in Princeton. And so I can tell you that, Sarah, you're absolutely right, that 15% of our kids, are on free and reduced lunch. And that was something that we had to plan for as well, as to take care of the kids and their families who may be going hungry in this community, which is a much wealthier community. And so you see that in district after district here in New Jersey. And it affects all of us, but it builds on the inequalities that already existed pre-COVID-19. So Sarah, you're right about that.
Okay. And just real quickly, for those of you who aren't familiar with the free and reduced lunch process, you have to sign up for it. And as someone who has sat with many people trying to convince them that it was okay to sign up, that the program was there if they needed it, I'll tell you that there aren't people who are willy-nilly saying, oh, well, this would be good. It's a you take your heart in your hand when you put in a piece of paper to your school and say, I can't afford to feed my child. So it's a pretty big deal. Okay, guys, I'm wondering, we've got some major pillar community organizations in this community. I'm wondering what they can do to help during this crisis. The schools, the universities, Greg, I'm going to throw that one to you to begin with, because I think the schools are a real good place to be starting.
I agree, Connie. And the reason why the schools can play such an important role and have historically, they were conceived of as as the hubs of their community back in the turn of the 19th century by John Dewey and others, is because if you are trying to reach young people and their families, one of the very best ways of doing so is to go where they are, and that's the public school buildings. And so that gives you a chance an anchor to reach them and to bring the services to them and to their families. And that's behind sort of the strategy of the community school model. So, I'll let Bernie talk about just one example of how Mercer Street Friends does that in Trenton. But it really harkens back to something that we've had throughout American history, which is the sense of we're all together, we're all a community, we all take care of each other. And I would argue that in a time like now, we need that more than ever. And so that allows for sort of working from the relationships that already exist between local businesses, between institutions like Princeton University for Princeton and for this region, and government agencies to try to break down some of the silos. So to get services to the people who need them, and HomeFront does such a wonderful job of that. And also, and I think just as important, to try to reduce the mistrust that so many people feel towards government agencies, including public schools and districts. And we have to sort of overcome that as well, and meet people where they are and meet what they need.
And I'll take the prerogative of the chair and jump in and tell you a little bit about one of the things I was doing today. Very cold outside. There's this thing called Code Blue, where when it gets very cold, the various communities are mandated to find a warm place for street people. Used to be the libraries, but the libraries are very closed right now. Used to be the churches. I was phoning a number of church bodies today that oversee groups of churches, whether they're synagogues or Catholic churches or the Presbyterians, that used to allow people to stay in their place during when it got very cold. They're closed now because of COVID. There are so few places right now that street people can be safe in this god-awful weather. That's one of the impacts of COVID. There was a guy in North Jersey who was found under a bridge last week, frozen to death. I mean, that's in this very wealthy state, people are freezing to death out there.
Putting aside the fact that we've as a state decided there is a temperature at which it's unacceptable to be homeless, as though 37 degrees is an acceptable temperature at which one should be homeless, and 31 degrees is not an acceptable temperature. But I have a whole separate speech I could give about that.
Great point, Sarah.
At least at the moment,
I'm grateful for it. Don't get me wrong. We have at least a minimum temperature, but
I'm not feeling all that positive about pillar community organizations stepping up. And
I think I would say from the HomeFront perspective, Connie and I talk sometime about working at HomeFront sometimes feels like working in an emergency room, right? Because people are coming in crisis or reaching out to us in crisis in one way or another. And so whether that's a food crisis or a housing crisis or a mental health crisis or whatever the case may be. And so obviously supporting organizations that are responding in that moment is incredibly important, right? The amazing work that so many of our partners do at the Rescue Mission of Trenton and the Trenton Area Soup Kitchen and Arm in Arm, and I'm going to get in trouble for naming some and not naming all of them, because they do amazing work and are our partners in that immediate crisis response. But I think we also, as a community, bear a responsibility then to help organize and prevent those things whenever we can, right? How can we work, and I know we're going to talk more about eviction in a little bit, right? But how can we work to prevent eviction, right? So yes, we need a strong safety net for when that family has reached the end of their rope. But what it just feels like we've all caught our breath enough to do is to talk about how do we put systems in place that catch families before that most desperate moment. You know, I think that's some of the most meaningful work we do at HomeFront, to work with families that are facing eviction or know they're on that path, and how can we help them get on a different path before they reach that traumatic event. So I am proud to be part of the community that responds in that emergency. I'll be even prouder when we're a community that has no one in that situation, because we've set up systems that help divert that crisis from ever happening in the first place. And that's, how do we do that, right? It's things like tonight, it's education and advocacy. And, you know, my background is in government and politics. And when I came to nonprofit work in this community, I was actually very surprised. I thought it was going to be more competitive or combative, or I don't know what I thought. But it's amazing to me, especially in Mercer County, how collaborative it is, and what a team it is, and how we've divided and conquered in a lot of ways. So I think we have strong institutions that deserve our support, and there's a lot of movement within our organizations to figure out how to collaborate and come up with those sustainable solutions. And it's done in a really impressive spirit of the mission that we're all here for. You know, like I said, I thought it would be more squirrely, but it's not. Everybody is are wonderful teammates in this.
Okay. Unfortunately, I need to raise a subject that I just even hate thinking about. And Emily, you're going to have to educate folks. This is about the eviction crisis that's coming. The tsunami, as I guess it's cliche at this point to talk about a tsunami of evictions that we're all expecting. If you could explain to people what the moratorium is, and then what's going to happen once it's lifted.
Yeah, well, basically, essentially what's happening with the eviction moratorium right now is that there's a nationwide eviction moratorium, the CDC eviction moratorium, which has been extended until the end of March for now, and hopefully will be extended further along, that where tenants need to declare that the rules of the eviction moratorium apply to them, that they've lost income due to COVID-19, that they meet certain COVID-19 restrictions, and they fill out this form from the CDC that they can then turn in to their landlord. The landlord has to acknowledge that they've received this piece of paper, and then that makes it so that the landlord can't legally evict the tenant without legal penalties and fines. However, we're seeing across the country that many people are being evicted in the middle of this nationwide eviction moratorium. And that's just because some landlords say things like, oh, I didn't see that piece of paper, I'm not going to take that seriously. Even some judges in various places are saying that, you know, that doesn't apply here, we've never heard of that. And so the kind of effectiveness of the eviction moratorium is different in all sorts of different places. One really difficult thing is that it's hard to determine exactly what's happening in this country live just because there's not a lot of information collected about eviction. And that's one thing that we do at the Eviction Lab. We are tracking in 27 different cities and in 5 states right now, how many people are being evicted during the crisis. And since last year, since March 15th, where there's been, between the CARES Act and the CDC moratorium, most of the country has been covered by an eviction moratorium. And then there's kind of been a patchwork of local and state level eviction moratoriums. There's still been close to 300,000 people being filed for against eviction in the past year. So that's way fewer than that 3.6 million people. But that means that there's still a really, really large number of missing evictions across the country. So the kind of what you would see normally and what you would see in what we're seeing this year, those people still owe rent. So the CDC moratorium isn't a rent cancellation, which would mean that rent is forgiven. What we're seeing now is people who are being filed for against eviction are owing 3 times as much as people owe in a typical year. So that means that families are even more behind on rent. Obviously, the CDC moratorium is a good thing, like it should exist. It's good that people aren't being evicted in the middle of a pandemic, but it doesn't change the fact that, you know, these millions of families still owe, 3 times as much as they might another time. And that's only the people who are being filed against and only the data we have. So we're sure that other people are owing lots and lots of money. And so there needs to be some sort of rental assistance or cash assistance or stimulus in order to help families kind of make up the difference. Otherwise, whenever this, COVID-19 pandemic and the CDC moratoriums come to an end, families, it's not like they have this money somewhere. They don't have this money, and they will be evicted, and they will have that on their record, but also they will owe an extraordinarily large amount of money. I'm not sure if I can elaborate any more, Connie.
Okay. I think you did a real good job of beginning the explanation. In New Jersey, the moratorium is in place until at least May 19th. Our governor did a clever thing and said the moratorium would end 2 months after the state of emergency ended. But I'm going to surprise folks, I think, and take the side of the landlord. HomeFront is, because this is such an incredibly complex issue, HomeFront, sister agency, Homes by TLC, has about 120 units of permanent affordable housing. People have stopped paying their rent, most of them because they can't pay their rent because they've lost their jobs. But some folks who were on a fixed income have chosen not to pay their rent. Well, HomeFront can't pay our mortgage. HomeFront can't pay to have the lawn mowed and the snow shoveled if we don't get paid. So it's not an issue of the bad landlord. And I think in some parts of the country, it's beginning to be painted like that. As Mitra just wrote in, private individuals as landlords need their money. So it's an incredibly complicated problem. Government at all levels is trying to come up with some answers. Philanthropy is trying to come up with some answers.
One thing certainly is that the rental assistance helps both the tenant and the landlord. So rental assistance makes the landlord whole and also prevents the tenant from having an eviction on their record. Another thing that we do often like to talk about at the Eviction Lab is just particularly the issue that landlords, when they take this on, this is a business venture like any other one, where the person in business does stand to lose money. And so I guess those might be some useful things in helping to reframe how we think about eviction, just particularly because it is so scarring for families in the long run to not have housing. And we, as a country, as a society, it's really important that we make sure that families stay housed.
Yeah.
And that people continue to go into the business of supplying affordable housing, low-income housing. It's we know a lot of landlords who are trying to sell their business, their housing units now, because they don't want to be in this business anymore. We don't know many people who are trying to buy them, and that's very scary. Because
Well, hopefully there could be a future in which, we can use this time of having distressed housing, lower housing prices in order to create more social housing, and having kind of different and innovative solutions. I know that's something that they're talking about a lot over at NYU. They're kind of talking about, what would it look like to have social housing created out of kind of the currently unpurchased units. Like, I think there's lots of things that municipal, state governments, and obviously the federal government can do to make sure that families stay in their home beyond what they're doing right now.
Yeah, we need a bridge to some sense of normalcy when public policy can be, appropriately debated and determined, in more normal times. Right now, we are in a crisis. And if the federal government can issue trillions of dollars, worth of support in different areas, they can certainly find a way to target this critically important area. The knock-on effect, the cliff that we are facing with regard to the community that is going to be subject to eviction at some point, potentially, is going to, in my view, just off the cuff, probably be more costly than that financial bridge that the federal government can provide in a targeted fashion. And I'm sure Emily and her team and others are lobbying hard for that down in Washington, D.C. But it's got to be hard, to even raise private philanthropic dollars for some of this, because there is a substantial role in good public policy, at the federal level for this type of crisis. I mean, this is unprecedented, but it does speak to the fact that we as social service organizations that are all impacted and try and address the homelessness and the hunger, we are in the soup here for quite some time to come. And that's a particular challenge for each and every one of us. It's one we're facing at the food bank, because we've gotten plenty of government assistance and wonderful generosity from the philanthropic community. That won't always be there. I will tell you, from a hunger standpoint, we spent $400,000 on food at our food bank in 2019. In 2020, we spent $1.8 million.
wow.
Now, we didn't give out 4.5 times more food, but the donated food dried up, no more food drives for a while, they're starting to come back. But consider that, from a monetary standpoint, just to make sure, that we were continuing to operate on behalf of our pantries, 4.5 times, more money spent on food. And we're on pace, we think, for, that kind of expenditure in 2021. And we have support for it. We're governments come through, private individuals and foundations have come through, but this is the reckoning that we have, that my understanding from other food experts, this is likely to stay with us for years, just like the Great Recession stayed with us for years.
Yeah, and I think that's a real danger in some ways, right? Because everyone is so eager to get their vaccine and get back to normal and get over this chapter, right? Count me among the people who are eager to move on from this. But the people who are going to be hurt from this in that long tail, right? The people who are going to be facing the effects of COVID, not the disease, but the economic crisis for the next 5 to 10 years, are not going to be over it, right? So this it keeps me up at night to think about, I feel like every day we're moving closer to normalcy, right? You hear that all the time. And again, I'm here for that, but we can't forget that when my life gets back to normal, that doesn't mean that everybody in my community's lives have gotten back to normal. And so we at HomeFront and in our community are worried about when the attention changes, right? When upper middle class families are living life as normal and it's not as present in your mind. Where is that support going to come from? Not just financially, but keeping this as a priority, right? When this becomes a really dwindling number of people who are still feeling the economic effects of this every day, the public support is going to drop as well. And so it's one of the things that we're going to talk more about what people can do, right? But part of it is keeping this conversation going. Because even if our lives have improved and gotten back to some sense of normalcy, there are going to be thousands of families in this county that are not going to be back to normal. And we can't, as eager as we are to turn the page on the last year, we can't turn the page until we've brought everyone along and gotten everyone back to where we were. Because guess what? A year ago, things weren't great either, right? And so we're just clawing to get back to a situation that was not great. But I think there's going to be a real danger of just this fatigue of thinking about COVID and dealing with it and all the rest of it. Like, we just want to move on, don't we all? But the crisis for families, these evictions we're talking about are going to take place much later in this calendar year, right? After a place where hopefully the vaccine is plentiful and all that. And that's when it's not going to be as visible and present. You're not going to see the food line on the top of the NBC Nightly News anymore, but I guarantee you it will still be there.
I do need to add something to what Bernie was saying about the role of the federal government in the emergency crisis. Part of the reason we're here in this horrible place in terms of housing crisis is that in the old days, after World War II, there was a commitment in this country to make sure that anybody who worked 40 hours a week could put a roof over their kid's head, as long as they were white. That was federal housing policy. But since the beginning of the Reagan era, through both Republican and Democratic administrations, the amount of money allocated for housing supports has dried up by 90%. There is no longer that basic assumption that people, if they work 40 hours a week, have a right to be able to have a safe place for their kids to sleep. So that whole change has to be.
You have to work 3 full-time jobs at the minimum wage in Mercer County to afford a 2-bedroom apartment at standard market rates. 3 full-time jobs, right? So this isn't a question of our families working. You have to work yourself to the bone to afford an apartment at going market rates right now.
Okay.
And I think that's absolutely right, because back in the Great Depression, and what we're talking about today is analogous to not only the Great Recession, but the Great Depression. Well, during the Great Depression, the federal government stepped in when people started losing their homes, and they themselves took over the task of refinancing middle-class homes so that people wouldn't have to walk away from their homes. Because in the long run, as Bernie and everyone else said, it's more expensive to have people evicted, to have people lose their rentals, to have the people lose and be foreclosed upon. It's more expensive to go through that process. Never mind that it's also immoral, but it's better policy and less expensive to help them before they get to that point. We've done it before in the past. So it's a question, as Connie said, to recapture that imagination and boldness in our policymaking. And it has to come from the federal level, because the states don't have the money and the localities don't have the money.
Somebody had a question that they wanted to confirm what Sarah said, I think because they found it unbelievable. Sarah, repeat how many hours a week somebody has to work in order to afford the average fair market 2-bedroom apartment in New Jersey.
So that's just about 3 I think it's like 2.7, right? I'll pull it up and I'll put a link in the chat. Our friends at the Housing and Community Development Network of New Jersey every year put together a report that they call Out of Reach, that compares the current wages in New Jersey to the current housing prices. And I believe their most recent estimate statewide was 2.7. I think it's 3 full-time jobs at the minimum wage, but I will send the link out in the chat here in 2 seconds.
Okay.
But you did not hear me wrong.
Okay, we can't leave on this note. How can people be part of the solution? What can individuals do from home to help these struggling households?
Well, I would say that people can be very intentional in who they support and how they support. And going back to pillar community organizations, Connie, I think part of the solution for our community and communities across the country, are those pillar organizations. And I think started by the nonprofit community. I see the best collaboration, as Sarah pointed out, the best cooperation happening among the nonprofit community, primarily because of the various missions that all touch on hunger and homelessness and education and such, taking care of people, and the fact that the nonprofit community has very limited resources. So it's by necessity. The efforts that the leadership, the executive staff in our nonprofits undertake to ensure that everything gets done on a day-to-day basis, responding to crisis and planning, when you have time for it. The nonprofit community sets the example. So the pillar organizations in the nonprofit community, I would say to those who are listening to us, pick out your organizations that are pillar organizations, support them, and make sure it's intentional in that for now, it might be cutting a check or attending a session like this. Over the long run, make sure that there are connections being made between and among our organizations, and that you're holding accountable your auto insurance company, NJM or Geico or Allstate or whomever, and how are they responding to the needs in the community? And make sure you're holding accountable where you send your kids to college. We've got wonderful higher ed institutions who are doing a great job. I'd like to see better collaboration and coordination the way the nonprofit community does it with our higher ed. Anchor institutions that come together and collaboratively help with some of these very difficult issues. Our government, state government needs to help the city of Trenton, needs to help Mercer County, this community. Local government, can the city of Trenton do a better job in collaborating with nonprofit communities and the higher ed institutions and the business community? They sure can. They sure can. So, but it starts with pressure being created by those who are intentional. And so our viewers who want to be intentional with their giving, with their intellect, with their level of interest, and let's hold all of our organizations accountable for being part of the solution in our community.
I agree with that. So in wearing a different hat, I am a local elected official, and I am asking for trouble by saying this, but I literally never hear from anyone about these issues on the local level. And you should be in touch with the people who represent you, if for no other reason than to say and to reinforce that you care about these issues. Don't undersell how influential you are. Yes, in terms of your representatives in formal government, but nearly everyone has some space, right? Whether it's your neighborhood association or your congregation or your community group or your alumni association or your book club or your extended family, whatever it might be, right? And your voice in those spaces is really important. So I give everyone who's on with us tonight a lot of credit for caring enough about this to get on and spend an hour with us, right? And so what I challenge you to do is to think of how you can use that voice, right? Can you get your neighborhood involved in a food drive? Yes, it's about the food. And of course, we are so grateful for the donations that come in and literally keep our food pantry stocked. But also we know every food drive is a time that someone spoke to 10 of their neighbors. Did you know that there's hunger in our community and there's something we can do about it, right? And so we can have the most excellent group of nonprofits in the world working hard on this, but if we don't have the support of the community, and not just in terms of your dollars, but in terms of your hands and your voice, we're not going to get anywhere. There are so many organizations and community groups that give so generously of their time and their talent. But I'm just saying, don't undersell yourself. You know, I'm sure people who are listening to me who think I'm not influential in any group, right? I bet you if I got on the phone with you for 15 minutes, we could think of the groups or the people that would hear your voice or that aren't hearing my voice. And so that can be a really critical role that you can play of helping us amplify this and making sure these families aren't forgotten 6 months, 12 months, 18 months from now.
And I just to add to this, because I'm a little bit of an outsider looking in, and I think tonight you see a wonderful example of this sort of partnership and cooperative behavior of these great organizations that are working so hard on behalf of our neighbors, our residents, our friends. And so supporting them is absolutely critical. And I'd also say that as citizens, we also have the ability to, as Sarah said, push at the federal level as well. We have the opportunity for another relief package that's being debated now. I don't think it should be a partisan discussion. The need is tremendous. We've heard this tonight. We know this just by seeing what's happening around us. And so we need the federal government to provide the resources to help the organizations who are doing the great work on the ground. That's my plea.
Okay, we're gonna, Kim, can we ask some live questions from the audience?
Yeah, I'd love to. We have a bunch
Great.
between the chat and the Q&A. I think starting with carrying on with the responses that you've been giving, Mitra Kelly specifically asks, who do we write to as residents of Mercer County and the state government to ask for support on housing and food?
The answer is it depends on where you live in Mercer County. We are represented by several different folks in the state legislature. And so if you go on the state legislature website, you can look up which district you live in. So you'll have one state senator and 2 members of the General Assembly who represent you. And so I assume most people are from Mercer County, but that goes for anybody in New Jersey would have that. So I can put the link in the chat to the state legislature website where you can look up who your representatives are.
Right. But I would also urge Mitra to get in touch with Brian Hughes, who doesn't hear from people that the issue of hungry kids.
That's our Mercer County executive. If you're not an expert on local politics,
is you know, nobody. Though I've talked with Brian often about the number of calls he gets about potholes.
Yeah, he needs to get more calls about, you know, kids being hungry than potholes. And listen, Governor Murphy, Senate President Steve Sweeney, and Assembly Speaker Craig Coughlin, those 3 have proven to be strong proponents of aid for food banks and food pantries. So please, if you are writing to your local elected officials and you know, state legislators, please include them as well. They need to hear that they are doing the right thing. And the budget discussions have already started for June 30th of this year for state-wise. So very important.
And I think somebody else commented about your local municipalities. So some municipalities have some funding for COVID relief. Usually it's sort of larger municipalities, but it's worth asking your local folks, your mayors and your council members, if they have any discretionary funding that's going towards COVID relief and how that's being spent. Some towns have been very creative in setting up rental assistance programs or business assistance programs or increasing aid to food pantries or whatever the case may be. I can speak that municipal budgets are very tight right now, but some towns are being given some federal funds, as an example, to help with COVID economic impacts. And so it's worth checking in with your local folks too, to see if they have any of those and how, if at all, they're partnering with their local human services organizations.
I will also hop in to say that at the federal level, calling your congresspeople and your senator at their local office, so their office in New Jersey and not in Washington, D.C., is a really great way to get a hold of them. They do have to, there is someone who has to pick up the phone or listen to what you say, and it does matter quite a bit. And there's ways in which you can also get involved in advocacy organizations, working with other folks, faith groups, et cetera, where you can come together and pressure your local government as well as the federal government for changes to food security and housing security.
Thank you. And just to everyone in their audience, if you haven't picked this up yet, there are hungry people in your community, no matter where you live. So all of these efforts are really important. We have a number of questions that are sort of health or medical related. Adelaide Zabriskie asks, could you speak about medical care for this population? She's thinking about Planned Parenthood and somewhere children might go. Mitra asks, how has the cost and access to healthcare been affected by COVID, period? Do you provide it at all in addition to the vaccines? And then Lucy Pesh, sorry, I'm like bundling these all. Lucy Pesh asks, can you talk a little bit about how the higher COVID rates in Black communities have impacted the way organizations like HomeFront have responded?
Where should we start, folks? Healthcare in Mercer County for poor folks is really pretty good. We don't do a bad job at all in large part. Henry J. Austin Health Center is a pretty well-run organization these days. And our hospitals are really pretty responsive. I'm going to brag for a minute on Sarah and something that she did this week in terms of responding to one of those things. HomeFront was blessed with the ability to get a lot of folks vaccinated, and HomeFront, led by Sarah, has spent the last couple of weeks making sure that there is a major education campaign so that African Americans and Latinos especially had access to doctors that looked like them and that spoke their language, not only for big group discussions, but for private consultations. Sarah was responsible for getting 400 and almost 400, a little over 430 people vaccinated, most of them street people and folks who are at highest risk.
Yeah, and the challenge there, of course, is, I think Connie's right, our especially our emergency healthcare, our crisis healthcare delivery for low-income families is good. There has been such systemic underinvestment in communities of color and their access to healthcare over the years that there is not the same network of trust. There is not the same network of accessibility and availability of care. So we saw that, right? We had the most precious thing. We had the vaccine, right? And so I was calling our HomeFront families, begging them to take it. And obviously we got a lot of yeses, right? But there's a lot of hesitance, and some of it very well founded, right? And so I think you're going to be hearing a lot about that. The very insightful person who asked about how do we reach communities of color, right, that are being most affected in adverse outcomes in this disease, are also the ones where the infrastructure to reach them with the vaccine is the weakest. And so it's what Connie and I talked a lot about, that, we talk about dismantling systemic racism and taking our role in that process. This is what it looks like. We have to work even harder to reach the families in those communities with the vaccine and with good care, because that's not going to happen naturally, right? If it's always going to be a system where, the person who can work the website the best is going to get the vaccine first, guess what? I can tell you who that's going to disadvantage immediately, right? Our families are still having trouble, some getting internet access, let alone being able to navigate the complexities of the website scheduling that I'm sure many of you listening are fighting right now. And so it's going to take even more attention. I'm super proud of what we did this week, but it's a drop in the bucket in the grand scheme. And it's going to take us being intentional about the way the question asker put it in a very strong way of how are we reaching the families that are most affected. So hopefully it's a chance for us to strengthen the underlying systems, so there are networks of trust and care that those families are wrapped in. For so many of our families, to Connie's point, was getting them in a conversation with a healthcare provider who could answer the questions that we all have about this, and helping them feel comfortable with making that choice for their family. And so just getting people in a situation where they have a trusted healthcare provider in their lives will completely change the equation on that. So we do have a good system. We have a ways to go systemically to make sure it's serving everyone as best it could.
Other questions, Kim?
Yes, Debbie Brown, you sort of spoke about this, I know, a little bit during the discussion, but she says, how has this type of terribly cold and wet, snowy weather we have been having these last few weeks impact the homeless and those with food insecurity? What types of additional services do your organizations provide during weather like this? That was a question that was upvoted a couple times.
Sarah and I were on the phone last night at 9 o'clock, agonizing over, do we close today our food pantry? We know there are hungry people there, but we don't want to put our staff in danger with the weather that was anticipated. Horrible decisions like that we're making. The rescue mission and task have partnered up to make sure that in our community, unlike many other communities in New Jersey, that there is a safe place for street people to go, at least if they live in Trenton. God help you if you live in East Windsor, but if you live under a bridge in East Windsor. But if you are anywhere near the Trenton area, there is a safe place to go in this kind of weather.
And you may think Connie's being glib. There are unsheltered homeless folks in every community in Mercer County. That's not a glib comment. That is a reference to actual facts.
Yeah.
So we do have that system in Mercer County. It's something we've fought for statewide. It is obviously a Band-Aid on a much larger problem, right? And so the real solution is making sure people have safe homes, so that we're not scrambling every time it snows to make sure no one is freezing to death. That is how we solve that problem. It is not how do we solve the problem of, oh, it's gotten cold enough that we should make sure no one dies tonight. Obviously, that's dealing with the symptom and not the illness. So I am super grateful for our amazing partners who have put at least that into place and have gotten support from the government on that. But it's one of those things where we have to step back and look at ourselves and, like I said before, ask why we're okay with that at 40 degrees and not okay with that at 30 degrees.
Yeah.
That's very true, Sarah. And that reminds me a little bit of, too, I think, how we're talking about how displacing people from their homes during a pandemic is awful. And I hope that we can start thinking about ways in which, there are things that aren't okay in a pandemic. They never were okay to begin with. And we have now things like eviction moratoriums. And if we can think about how to kind of incorporate them into life kind of after the pandemic.
Yeah.
So hard because there's so much work to do and so many people who need help, particularly at this time. In the chat and throughout the program, we've had a lot of people. I just want to take a moment to say that there are a lot of people that are here tonight that recognize all the hard work that you're doing and are offering thanks for the presentation and for the work that you're doing to try and meet the needs of people in our community, everybody in all of our communities. Just to finish, I guess I would ask, I don't know if it's a hopeful question or a prayerful question or whatever it is, like, is there a hope? Like, what's your wish? Like, if you could have like one thing that you're wishing for right now, whether it's tonight or just generally, if there's something you can offer. No pressure. You can have 2 wishes.
I hope you go talk to 10 people in your life about this, who you wouldn't talk to otherwise. Hey, I heard a really interesting thing. Did you know it's 3 jobs and minimum wage, or whatever it was that captured you? Because I believe deeply that this isn't going to change until we as a community say it's unacceptable for there to be hungry homeless folks. And that's the power that we all have. Yes, we have our dollars and our hands and our voices, but that's more important than you realize.
Yeah, and I would say I'm very optimistic in the sense that we have tremendous nonprofit leadership that I think over the long run, will help inspire more collaborations in other sectors in the state of New Jersey. The point's been made, but we have enough resources in this state to address these problems if everybody comes together with collective and achieves collective impact. Nonprofit community's doing its part. We need help, and that's everyone on this call is part of that network.
Maybe I can end on a happy note. Yesterday, we had a social media post, and the gal who runs it got a call, got a text back from someone, and then they had a phone call. It was a young man named Jamil, who, well, not so young anymore, but who had been one of our first Joy, Hopes, and Dreams children over 20 years ago, and had been part of Chris Marchetti's, who runs our Joy, Hopes, and Dreams program, did it then, does it now. And he saw the post about Chris and what Joy, Hopes, and Dreams program was doing, and he reached back to say, hey, I was a JHD kid, and now I have my own plumbing business, and my life is good, and having that program helped me get through the most horrible days of my life. It matters, and that's a happy thing.
Well, thank you all so much, Connie, Greg, Sarah, Bernie, Emily, for coming here and sharing all of this information with us this evening and helping us to get a better understanding of what we can also do to support the work that you're doing and to support our neighbors.
Thank you.
Thank you all for coming.
Bye-bye.
Thanks.
Thanks, everyone.